Okay.
Larry, let you bring it up, and then we'll close things up for questions. Well, I got 10:30. Well, good morning, everybody. We'll go ahead and get started here with our press conference this morning and information for everybody. I want to bring you up to speed a little bit on where we're at, kind of what's happening at the county. Not a whole lot new really happening there as far as from the COVID side. I did talk with with Bob Weaver this morning. He did tell me that out at the clinic that they had tested 123 tests out at the MedStat so far since the last 2 weeks, which is good that we're getting those individuals tested that need that done. So that's been good. You know, other than that, as far as from a county perspective, things are, you know, as normal as they can be during a time like this. But on and all, offices are all opened and moving forward with progress, getting ready to start into our budgeting sessions here soon. So starting to work on budgets and different things. So interesting to see how those shake out over the next couple of weeks, or next couple of months. But you know, this morning I don't really have a whole lot else from the county, but we'll turn it over to Bill and see what he has to say on the latest on his perspective.
Sure. Thanks, Kerry. The cases continue to go up regarding COVID-19 in our county. It took us to Memorial Day, roughly, to get to the 100th case, and since then, approximately 100 cases each week. So we're over 300 now. The frontline feel to this is a little heavier. I don't sense our local hospitals swamped by any stretch of the imagination, but they're seeing a few more cases. Regionally, Elkhart County, their hospitals are seeing substantial surges into their ICUs. So we continue to encourage these messages that you've heard to be mindful of social distancing. If you're in a crowded environment, consider a mask. And if you can avoid a crowded environment, we think that's best. Frequent hand washing. And if you're ill, please stay home. Don't go to work. Don't go to summer school. Try to diminish the spread of your respiratory infection to those around you. So sounding like a broken record, I suppose, but these messages, I think, are still worth saying. Our surge now, I think, is a bit heavier than the small surge we felt about 2 months ago, earlier in this COVID pandemic. We didn't have as much testing then. We have a lot of testing now. So some of our numbers, honestly, are because we are doing a lot more testing, but it's also because we have more illness. Fortunately, most people ill with this will never need to be in a hospital. It'll be a mild, self-limited illness, a few days, and you're better. So if anyone is mildly ill with an acute respiratory syndrome, stay home. If you would like to be tested, there are many opportunities for testing, and those should be cost barrier free to you. So take advantage of that. If you are increasingly worried about your respiratory syndrome, seek health care. If you have a private physician, start there. If you're unable to find that, go to an urgent care center. If you're really concerned about your clinical presentation, particularly if you're becoming short of breath, then get to an emergency room. We have schools on our minds at the health department, and we're pivoting our resources to them in the last few days. We are less in the weeds with each individual case contact investigation. The state has a contractor that's doing the lion's share of that now, but we are still engaging locally. We still get lots of questions, lots of interfacing with positive cases or clusters of cases, and we remain very involved with that. But we're trying to get our heads above the clouds a bit so we understand the current thinking and the temperament of that thinking that's coming from the Indiana Department of Education, and particularly of import to this local health department is the Indiana State Department of Health, and trying to lean into their best guidance of the moment. It remains a very fluid and dynamic topic, so even expert guidance has shifted around quite a bit with this, and we're trying to keep our finger on that pulse. We want to be there for our local school administrators and for their school nurses who will be feeling this in a big way, and we will be wanting to be freed up to help them as they engage with students coming back to school in just a few weeks. So yes, we're seeing more cases. It's not a disaster. Most new cases are not critically ill, thankfully.
I was gonna say, that was one of the things that I noticed on Nicole's little chart was the number that are being hospitalized really isn't
Still remains
changing.
low. For those who really want to engage with this topic, the sophistication of the Indiana State Department of Health dashboard has really improved over the course of this. There are all kinds of sublinks you can click into. Anybody can. The Regenstrief data is particularly interesting, I think. Of course, I'm a public health guy, but that's a lot of syndromic surveillance, looks at ICU use, emergency room use, that kind of thing. And it to some degree, can be clicked down to the county level. And even within their subdirectory on that dashboard, you can click on new references they have. You can look at trend data, and they've color-coded counties across the state. We are a green county. We're doing pretty good, it looks like, right now. But just adjacent to us, a little concern in Elkhart County. So there's a wealth of information there. So in light of all that sophistication at the state's resource, you'll see our daily briefings from our local health department trim up a bit to all of you. The frequency will be decreasing. Again, all that is within a motif of you've got great resources elsewhere that are just a click away, and we need to get freed up a bit to help our new venture with schools, which we see as a priority. So, thanks.
Well, I know, Dr. Remington, I just want to thank you and your staff. I know Teresa and Nicole and yourself, I've heard nothing but positives from the school corporations and just the community as a whole, just how you really leaned into this and really help them through some uncharted waters of what to do and what the next steps are. So I really appreciate all that you guys have done through this. I know it's not been an easy task, and I'm sure a little bit growing weary of just doing good, but at the same token, we appreciate all that you're doing for us. And I know it's made a big difference in our community to give them some peace and just having a resource to be able to call upon and get some information that's it's based upon fact and real in our community versus what you might see on the TV. So
Sure.
Appreciate all that.
Sure.
From there, we're going to roll over to Larry. He's going to talk a little bit about the city's parks and how that might look like opening up here over the next weeks or so.
All right. Thank you, Gary. I'd like to start my reopening of the parks with a quote from the National Recreation and Parks Association that I read in a book, and I thought it was very spot on. There's an old adage that absence makes the heart grow fonder, and sometimes it takes a global crisis like the coronavirus pandemic for people to truly appreciate the value of their parks and open spaces. That was spot on. I think we as a community have experienced this as the calls come into the office daily about the amenities of the park and the recreational programming. When will that happen? Heather has taken several calls, and she's our first line of defense and information for this to the public, and she's did a great job on that. I'll just go through a few things here. Our park office is open to the public with masks recommended. The parks and greenways have been open throughout the pandemic with social distancing in place. Our beaches just opened last week. I want to reiterate that there's no lifeguards at our beaches due to a shortage of lifeguards and the timing of lifeguards. If we did have lifeguards, I mean, they would only work for a month and they'd have to go back to school. So we're not going to have lifeguards this year. So it'll be swim at your own risk. Playgrounds are open. Again, we're preaching social distancing on those and hand washing and when you're done. Basketball courts, tennis courts, pickleball courts are all open. Our campground is operating with seasonal campers as of right now. At July 4th, we'll open up. We have 4 or 5 spots opened up for daily or weekly or monthly rental. So we're almost at capacity at the campgrounds right now, and things are going really well out there. Shelter rental is available at 50% capacity right now. We're trying to allow the social distancing in our shelters, so 20 to 25 people per shelter. Our rental buildings, facilities will open after July 4th. That includes the night youth cabin, the fireman's building, the pavilion, the Lucerne Amphitheater, and the Center Lake Plaza. Those will all be at reduced occupancy. So we'll be at 40 people for the night shelter, 70 for the fireman's building, 125 for the pavilion, and then 150 for the amphitheater and plaza, which are outdoor adventures. Disc golf at Lucerne Park, many are playing that and have through the whole pandemic. It's a good getaway. It's a good way to social distance and have some recreation and get walking through the park and have some fun activity. The Higher Park BMX is open for practicing and local races with restrictions, masked, social distancing, and no crowds during practice, and limited crowds during racing is being enforced. Young Tiger football is scheduled to start practice August 17th with in-house gameplay on September 12th. They've worked with the IHSAA, the Indiana Football Coaches Association, and the Northern Indiana Football League for guidelines to follow. Social distancing practices, masks worn by coaches and board members, and only players are allowed in the facility during practice, and game day in-house play is limited to parents and siblings with social spacing practices. We've worked closely with Coach Bart Curtis at the high school as well, and the coach feels that we can get some great football teaching and practice in by just having an in-house league as opposed to a travel league. So we're not bringing other areas into our area, and we'll have a limited amount of games, but we feel that this is a great way to keep our kids safe and have some football in practice. Programming, all of our programming are pretty much virtual. Supplies are being picked up at the office, and we're also delivering to people in Warsaw and Wayne Township. So what they're doing is they're registering online, they're coming to the office, or we're delivering the products to them, and then we're doing virtual painting, virtual cupcake parties, all kind of things. I mean, Sheila and Stephanie have did a great job through this whole thing, just trying to think outside the box and how we can keep people involved and in recreation and still be safe. So the one thing that we're going to try to do, we're going to try on July 10th to start our summer concert series at Central Park. These are probably our 150 to 200 people concerts. They're not our national concerts like our rock and blues. Those are canceled for this year, but these are smaller scale concerts, and we're going to try to have those and practice social distancing and have people bring their lawn chairs, and we're actually going to put some circles in the grass to try to keep people separated and see how that goes. And if it goes, we have 6 of them scheduled for this year, so hopefully that'll go well. The Mana Skate Park is scheduled to open July 6th. Participants must bring their own helmet to participate. Participation will be limited to a safe number within the park. Rotation will be done if necessary. If we get an influx of people there that want to skate, we will move them in and out and try to keep that social distancing and keep people safe. I hope everyone practices social distancing and limits the number of people in gatherings and enjoys the parks and safely does that. The more we follow the rules and keep people distance and prevent the large gatherings and groupings, I think things will go well. Over the weekend, the beaches, we monitored those, and they seem to be doing pretty well. I mean, it was only 70 degrees and people were spaced out a lot, but we'll find out more when we get these 90-degree days, how many people we have down there. But I would just ask people to, respect your neighbor and try to keep that distance and enjoy the parks. Thanks,
Thank you,
Gary.
Larry. Ton of great information for us there, and I guess I'd just like to commend your staff and just some of the innovative ways they've been able to still try and engage people in the different programs that you have. And I guess if there's anything about this pandemic that I guess I've been impressed with is just how people's had to get outside their comfort zone and get out of their normal little box and be creative, and how can we do the things we used to do, but in a virtual way or in a new way that, some ways may even been better than what they had been in the past, that it's forced us out of our comfort zone and forced us to step out there and maybe do some things we wouldn't have otherwise done, but this has kind of given us an opportunity to look for those things that we can change and get better and make a better community for our residents here. So appreciate all that.
Well, thank you, Gary.
From there, you don't have anything else, do you?
I do not.
Okay. From there, I guess I'll open it up for some questions here. Dan?
Dr. Remington,
Yes.
you mentioned pivoting more resources toward the schools. Can you give us some details on that? And as the school year arrives, how much testing? Can you give us some ideas on what you are suggesting as far as testing students and/or teachers and
Sure.
staff?
So we're very attentive to the quickly evolving direction from the State Department of Health and their thinking towards reopening schools. That alone takes a significant amount of time to dig through the documentation that's coming to us, webinars, printed documents. The Indiana Department of Education and their directive for reopening schools was pretty extensive, had a lot in it. So our communicable disease staff, as well as my administrative staff here downtown, needs to spend time with that. I personally need to spend time with that. And which means we need to come off the phone a little bit with every case contact detail. We need to be engaging with school nurses and administrators and connecting with them, whether it be through emails or phone calls. We anticipate a growing amount of requests to our department from them. Already we're sensing that, to help them wade through all the details of what this looks like as they open up in a few weeks for school. We want to be there for them. We can't draft their policy for them. That's not our intent at all. But we want to be a listening ear and advisors and thinkers with them as we look to state guidance. That state guidance will continue to morph, and I think personally as we get closer to the start of school, and particularly after the school doors open, there are going to be lessons learned very quickly. Strategies that are just not tenable and others that are durable. And that expert guidance, if you will, from Indianapolis will, I think, shift quickly. So we need to be freed up to watch that, to listen for it, and to be there on the phone or email with each school system in our county here. It takes time, takes human resources to do that. It takes cognitive space to do that well. So we're trying to create that at the health department now. We don't have a huge staff, as you know. Our communicable disease staff are 2 individuals. We swing others in as we can, and we have recently in the last 3 weeks. But it's a pretty finite pool, so just administratively, for me, we need to free that up. And we're very thankful that the state has a contractor now doing a lot of case contact work, so we feel a little more freed up. So there's been a paradigm shift, if you will, of kind of how we're engaging with this pandemic at the health department. Testing. Testing in schools, I think, is, again, another fluid discussion. I have not seen that strongly in the guidance, at least that I have seen, with surveillance testing applied to schools. So I haven't seen the motif that we're now using in nursing homes come to schools, where you take a certain percentage of staff or certain percentage of students and you randomly test them. I have not seen that. Whether that will come or not, I don't know. Depends on availability testing, expensive testing, and what you do with that, what you're willing or able to do with that information, of course. So testing still centers around, I think, best applied to those that are ill, close contacts of those that are ill, and those that worry you more, nursing home residents, certain demographic subsets of the population. And then we have the pragmatic of certain employers demanding testing for one reason or another. So we have to have that available for them. But I think still testing is best applied when it starts with a sick individual and works from there. And so I see that motif applied to how we'll approach this with schools, but we'll see. Surveillance testing may end up being a part of our work week with each of the school districts. We'll see. Mm-hmm.
Dr. Remington, LaGrange County has had a similar spike to what we've had here in Kosciuszko County, and just this week they've mandated masks for their residents. Do you see us going in a similar direction as what LaGrange County is doing right now?
I personally feel that if we just keep saying the messages we're saying and using a voluntary masking approach, that's good enough. I'm not sure when you get to universal masking mandates. I just wonder what the traction of that is in this part of the pandemic. I think we've burnt through some poker chips on what people are willing to do or being told they need to do, and I want to be very cautious there. I want to reserve those chips we have remaining for a real big moment when we must say those kinds of things. So I personally, even though our cases are going up in Kosciuszko County, I don't personally see this health officer making a proclamation of demanding universal masking. Thought about it a bit, in all honesty, after hearing that, but I still feel it's a bit of an aberrant voice in the culture we're at right now with COVID. No offense to the health officer there or the health department there.
This is for Kerry. The Ball State Center for Business and Economic Research released an analysis about how COVID's going to deeply damage the state's economy. And I showed you the press release beforehand. What has the county learned about its economic future and finances going forward?
Sure. Well, just yesterday we had a 2.5-hour meeting with Baker Tilly, which is a accounting firm out in Annapolis that specializes in doing financial forecasts for municipalities and local governments. So we had a nice meeting with them as an executive session with both the council and the commissioners yesterday, walking through, and they directly looked at some of the things as far as might be impacted. You know, each revenue stream has a different point at which it may be impacted. Some of them are going to be relatively quickly. Some of them maybe a year, or even a year and a half from now. And there's still a lot of kind of guesswork. You know, they were using some things of back in 08 and 09 of the recession to try and get some similarities of how things that were affected from an economic perspective when people aren't working. But they were able to give us a pretty comprehensive report that I know that both the council and the commissioners are going to, more council probably, they're the finance people of the county. I know that they're going to be looking at that and looking really hard at what kind of tough choices might need to be made for the finances of our county. Fortunately, we've had a lot of very conservative leadership in the county for decades, and they've done very well and put us in a position from a very low debt and some cash reserves that, can help us weather a storm like this. Not that we're not going to be unaffected by any stretch of the imagination. I mean, there's going to have to be some tough decisions that are made, but we're not in a position that we're mission critical by any stretch. And we've got several options, and that was a nice thing about the report. Not only did they point out a few of the areas that could be some concerns, but also gave some options on what we might be able to do to overcome some of those obstacles in the coming years. But it's one of those things. It's still a little bit early to tell. Property taxes did get pushed back a bit, but I think on a whole, most everybody paid them on time, even though they didn't have to. So I think that some of those fears that we thought everybody might wait till July because there wasn't going to be a fine, they were still due in May, but they didn't have to. They wouldn't be fined till after July 10th, I think was the date. Don't quote me on that, but so I do think that there's some things that seemingly are starting to see some good signs. I mean, our MVH money, or our fuel tax money for our roads, of course, April and May were definitely down significantly, and we're already seeing, as far as from NDOT does traffic counts, we're already starting to see those rebound quite nicely. So, some of these things are going to be relatively short term, but there is going to be some things that are going to be long term that I say long term, a couple years, that we're going to have to look at. But most everything that they showed us yesterday, by 2023, we were pretty much back to or even above where we were at the current revenue streams, at least at this point. But it's still a very fluid, situation that, depending on how things progress as we move forward, how quickly the economy truly recovers, as those people get back to work, I think as we can see those unemployment numbers continue to go down, that gives everybody a little more at peace that we're going to get back to a little more normal pace of employment in the area. So, but a lot of really good information that I think is going to help the council and the commissioners really make some wise choices moving forward. Dan?
Dr. Remington, Syracuse Town Council decided last night to close their beaches for the July 4th weekend, which, if you're familiar with Syracuse, they get big crowds, very dense crowds for the fireworks. So I was curious whether they had reached out to you for your thoughts, and also as we get closer to the 4th with our own fireworks in Winona Lake, is that kind of a fluid situation? Could you ever envision yourself maybe suggesting they not have the beaches open?
I think everything's fluid in this pandemic. I was not personally involved with the conversation with Syracuse. My department may have been, and I'm not involved with every single discussion they have. I think we need to stay tuned. I know July 4th is coming up pretty quickly here, and we need to continue to watch our numbers. What I did not see in our numbers was a doubling of the rate in the last week. So again, 100 new cases a week is substantial for our experience to date. And that's been present since Memorial Day, but we've not seen a doubling effect week by week since Memorial Day, which I would have a different message today if I was seeing that statistical phenomenon, and we have not. And a lot of the growth, some of the growth of our numbers reflects just more testing too. So all that to say why I've not had a forceful directive towards 4th of July celebrations in our county thus far. We need to just really keep watching these numbers, though. And I think from what I heard, Winona specifically, when they were represented last week, was that they were doing some things to try to mitigate the close contact and try to move toward a social distancing in some way. I don't know the details of how they plan to do that. So if that can be pulled off, then I think, and if you can particularly address that a large crowd gathering at the shores of Winona Lake somewhere to watch the fireworks, a large mass of hundreds or 1,000 people, if you can mitigate that, I think we'd be wise to mitigate that in some way. Would I cancel the event? No. Many people are able to watch the fireworks apart from clustering at the beach there. And I think I heard that in Craig's discussion last week. So they're very careful. Craig's a great thinker, and they're on this topic. It is a fluid discussion. Be certainly worth more discussion if our numbers in the county really escalate. I don't like seeing 100 new cases a week, but we didn't see 300 new cases in the last week. So, tough question, and a pertinent question with July 4th looming. I remember at the very beginning of this, my hunch was we would be having July 4th celebrations, but we'd be telling someone at great risk, just please don't go.
That's still the case?
I think that's still the case. Yeah. Thanks.
Larry, I was curious, I know that this year is different with lifeguards because of the shortened season, but a lot of communities are just stepping away from lifeguards. Do you think this is the end of an era as far as staffing lifeguards every year?
You know, I do. We've struggled the last 3 or 4 years to find lifeguards. We used to have 14 lifeguards on staff a year. We were down to 6. We were down to 4 last year. A lot of it has to do with being certified, the timing of the certified, the cost of the certification, and just young people wanting to do the job. I mean, it's a tough job. You sit out there and you look at the water, all day long in the 90-degree weather, and I'm just seeing, it's just not the Warsaw Park, it's the whole state. I mean, the whole state struggles with lifeguards right now, so I can see us going in the future with just no lifeguards and signage, yeah. Yeah, and I'd like to say also, I laid out all this schedule, for the football, for the BMX and everything else, but as Dr. Remington said, if things get worse, I mean, this is all tentative, things can change, in the future, but this is our plan moving forward, and it's all subject to change, but we've got to have a plan to try to get things in order and make things happen, so that's kind of where we're at with it.
Any other questions? Okay, well, we're going to round up a little bit early today, but that's not all bad. So thank you, everybody, for coming. You guys have a great day.